Let's turn now to the latest on the coronavirus. New numbers show almost half the new COVID-19 cases in the U.S. are coming from just 5 states: New York, Michigan, Florida, Pennsylvania, and New Jersey, made up for 44% of new cases in the past week, according to Johns Hopkins University. To combat the rising infections, some leaders in these hotspots are asking President Biden to change the vaccination rollout strategy, giving priority to struggling states. The White House, though, has shown no signs of shifting its current policy of dividing vaccines to states based on population. Willie.
Meanwhile, we're getting some mixed messaging from top health officials about whether there may be a 4th wave of coronavirus infections here in the United States. This is what CDC Director Dr. Rochelle Walensky said last week, compared to remarks from former FDA Commissioner Scott Gottlieb on Monday.
I'm calling on every single one of you to sound the alarm, to carry these messages into your community and your spheres of influence. We do not have the luxury of inaction. For the health of our country, we must work together now to prevent a 4th surge.
I would explain the upsurges that we're seeing the way I explained it, that this is a combination of the factors that I laid out, the variants, the seasonal effect, the schools reopening, people moving around more. And I don't think it's going to be the start of a true 4th wave. I think that this is going to be regionalized outbreaks, and hopefully we get beyond this as we vaccinate more.
Joining us now, Morning Joe Chief Medical Correspondent Dr. Dave Campbell and practicing internist, healthcare educator, and mental health advocate Dr. Lucy McBride, who has a new piece in USA Today entitled "Wired and Tired After Months of COVID-19 Distress. It's Time to Recover Our Mental Health." And I would agree that everybody is suffering, and I'm seeing among our young people a real change in behavior, much more fear, much more anxiety. Want to talk about that in just a moment. But first, Dr. Dave, these conflicting messages, part of the anxiety, quite frankly, that people are feeling. How do we pour through what we've heard coming really from the highest office?
Mika, it's at times helpful to have some anxiety when the stakes are so high. What we heard from those 2 experts are both true. The concern for a surge is real. We see the numbers going up, so it depends on how you define it. But the numbers are going up more in young people than in old people. And the old people have been largely vaccinated. And we also see these regional hotspots where different regions, even within different states, are showing more development of positive cases. And so we have to recognize that both are true. Both need to be prevented.
Yeah, I mean, Lucy McBride, we'll get to your article, but it could be true that we're headed for a 4th wave, but it also could be true that we're not. So
that's right.
What should the message be, though, in terms of how we move forward?
Thanks, Mika, and thanks for having me this morning. The message should be this. We have every reason to be hopeful. We have 3 stunningly effective vaccines that essentially take death and severe disease off the table, that reduce dramatically your risk of getting COVID-19 in the first place and of transmitting the virus to other people. They are powerful weapons against the variants, but we can have hope and caution in the same sentence. We can be hopeful and know that we have the ticket to our future in the form of vaccines. We can also be cautious. We know why cases are increasing. It's not mysterious. They are increasing because of the variants and because people are not, either because they can't distance, they can't separate from family in crowded living conditions, or they aren't using the very well-established risk mitigation elements, masking, distancing, and ventilation. But we can be hopeful and optimistic and cautious in the same breath.
So, Dr. McBride, obviously we've been focused with good reason on stopping this virus, on developing the vaccines, on getting everybody physically healthy. But you're also writing this morning about mental health, something that's always been there, that has accompanied this crisis. But it sounds like you're seeing a lot more of in your office. In fact, you write that our emotions are making us sick. What do you mean by that?
What I mean by this is that we all have mental health, right? It's part of the human condition. It's part of the package of being human. So if you have not recognized that you have mental health before the pandemic, you might have noticed it now. What I'm seeing in my office every day is people are stressed, they are anxious. We have been traumatized. All of us have experienced some version of loss in the pandemic, whether you've lost your job, you've lost a loved one, you've lost your first grade experience in the classroom. We've all experienced some sort of loss, and that affects us mentally, and it also affects us physically. So I'm seeing in my office the physical manifestations of people in distress, sleeplessness, heart palpitations, blood pressure surging. People are not feeling well. And so on the eve of recovery, we need to put our mental health and physical health together and dig out with mental and physical health tied together.
Dave, what more needs to be done in terms of coping with the anti-vaxxers and people who live with a fear of getting the vaccine, even though they know the vaccine might be extraordinarily helpful? They're still afraid or reluctant to get it.
Mike, that's a tough one, because what you're asking to do is to change culture and behaviors of people who, quite frankly, aren't listening to you right now, or probably won't go to the doctor, or if they do, perhaps not listen to them and listen to their neighbors and their friends, all of whom are looking at the same information. So we have this conflicting bit of information where by this weekend, half of the adults in the country will have some form of immunity, and the other half, though, won't. So as we are racing against, as Dr. McBride pointed out, the variants, the seasons, the behavioral changes, what you're asking is, how do we get other people that are thinking differently about the safety or effectiveness, or even the insult to their independence, to have a vaccination? And it is simply small steps at a time with public health officials, with doctors in their hometowns, with friends and families, always encouraging their friends, their family members who are hesitant, Mike, to get the vaccine, because it will help them avoid disease and it will help them avoid transmitting it to others. And Mike, especially the young people, because that's where we're seeing these surges in hotspots. It is in the younger population, the older folks, all of us. The majority have already been vaccinated or are otherwise immune, Mike.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.